Welcome to this week's edition of the Pete Mezzetti Show. I'm Pete Mezzetti. My guest this evening is Dr. David Banach, who is with UConn Health. Dr. Banach, welcome. How are you?
Doing well. Thanks for having me on.
Thanks for coming down. So, Dr. Banach, can you maybe tell us a little bit about yourself and your background, please?
Sure. So I'm an infectious disease doctor here at UConn Health. I have a role in a few different areas. I take care of patients, both up here at the hospital and in the outpatient setting. And I also have oversight over our infection control programs here at UConn and do some teaching at the medical school as well. So kind of a little bit of each. And in terms of the most recent years, a lot of that has shifted towards COVID-19 and our response from UConn Health in both taking care of our patients, ensuring the safety of our employees, and also serving the community.
Absolutely. Now, with what's going on with the COVID-19, how have you guys been handling from when it first started to where we are now?
Well, it's been quite a journey. I think back in early 2020,
yeah.
There was a huge influx of patients coming into the hospital with COVID. I think we were really hampered with our ability to test. At that point, testing was really limited. We were still learning so much about the infection, and treatment options were pretty limited. And our hospital census of COVID patients was quite high. And then, since then, we've seen fluctuations. Our hospitalization rates has kind of mirrored what's been seen in the community in terms of rising rates. Last winter, then a bit in this summer and fall, we've had some increase in hospitalizations. And then most recently with Omicron, interestingly, we've had a lot more infections in the community, and the rate of hospitalizations hasn't risen as quickly as it has in prior surges. So, we still have, patients with COVID here in our hospital, and, we're trying to, of course, now our treatments are further advanced, and and vaccinations, I think, are probably the most important intervention we've had so far in protecting the community, protecting our staff, protecting our patients. So I think we've come a long way in the last 2 years, that's for sure.
Right. Now, what exactly is the Omicron variants, and what's the difference in the different type of variances?
So I think the Omicron variant is unique from previous variants. It has many mutations in the spike protein, and that's the protein that binds to the human cells in the nose and in the lungs. So that part of the virus has mutated quite a bit, and it seems to make it more infectious. So it is more contagious. It kind of sticks more easily to those receptors in our bodies. And that makes people more vulnerable to becoming infected if they're exposed. So I think that's the major difference that we're seeing with this variant. We're still trying to understand severity of illness and how well vaccines provide protection, and then also looking at how it impacts some of our treatments in specific ways.
Right. Now, as far as the difference in, obviously, everybody has gotten their first vaccine, their second vaccine. Everybody hopefully has gotten their booster shot. Now, getting all three shots, that basically, what does that mean if you catch the virus?
So, what we're seeing is folks who have gotten 3 doses, so the 2 primary series plus the booster, have a high protection against severe infection. So, you still have those antibodies, those T cells, that are the critical part of your immune system that help prevent you from developing severe infection. So, that prevents hospitalizations and prevents mortality. And I think what we are seeing that those individuals who have gotten boosters can develop infection.
Okay.
But fortunately, in most cases, nearly all cases, it's mild and self-limiting. And I think that's important for people to know that the vaccines, and particularly the booster, really do provide a high level of protection against illness.
No, absolutely, and it's probably really important that you get all 3 shots, and then you go and get your booster. I know I got my booster shot a couple weeks ago.
Yeah, and I think that's the key message. We've as a state, we've done a great job in the initial vaccinations. We have some of the highest vaccine coverage in the country. I think getting the boosters out, still some work to do.
Yep.
And I think that's really what we need to help mitigate the impact of this Omicron variant on the community.
Now, as far as and I know the state of Connecticut has recently started rolling out their home testing kits. As far as the home testing kits goes, how accurate are they compared to if you go and get the test from your local pharmacy, or have a professional pharmacist or somebody professionally do it, rather than getting the kit from home and doing it yourself?
Yeah, so I think there's a few different parts to that question.
Okay.
The home tests are the antigen tests, and that is a little bit different than what we call the PCR tests. Those are the molecular tests. So those tests whether or not there's any presence of any virus genetic material in the nose. So overall, the sensitivity of the PCR test is a bit higher, but for people with symptoms, the antigen tests are quite accurate. They perform well, and I think that's really the best use for them. So someone who has symptoms, trying to distinguish whether it's cold or allergies or COVID, in that kind of setting, an antigen test can be helpful. If you want to increase the sensitivity of the test, doing a second test if the first one is negative can help do that. But I think it is also important to remember that the test is only as good as the specimen that's collected. So
right.
You're really making sure that if you're going to be doing an at-home test, you follow the instructions very carefully. Take a good specimen, a high-quality specimen from the nose. That's going to help sort of maximize the accuracy of the test. I think that's really critical for people to be aware of. The test is only as good as the sample that's provided.
No, absolutely. Now, obviously, the other thing we want to talk about is the quality of, I guess there's different varieties of masks that you wear when you have to mask up out there in the world. There's the blue masks, and then there's the KN95 masks. What's the difference, and which is the most common to wear to try to prevent the spread of the virus?
Sure. So, it's important to be thinking about mask quality. If you'll recall back in early 2020, there were hardly any masks available. And,
right.
We were kind of resorted to homemade masks and things like that. Now masks are much more readily available. And, there's several different types, like you mentioned. I'm actually here in the hospital. We have our blue kind of surgical masks.
Yep.
And these masks are effective. They have usually 3 layers of filtration. And then that's in contrast to masks like this KN95 mask that I have. These have more layers of filtration, usually 5 layers of filtration. So they provide a bit of a higher filtration. They also fit a little tighter. I think these KN95 for people who can wear them and are able to get them and wear them comfortably. I think that they're a good option right now, particularly in areas that are a little higher risk, like indoor spaces where there's a lot of people gathering. I think the added filtration can be beneficial in those kinds of environments. I am sort of encouraging folks to wear higher quality masks, particularly during this surge period where there's just a lot of virus circulating in the community right now. I think thinking about the quality of your mask as well as the fit,
right.
are really important. Having a mask that fits well, covers the nose and mouth, and really kind of fits closely to the face, is really going to help maximize the benefit from wearing them.
Now, in your opinion, as far as the masks go, how many days should you wear each mask for? Are they good for a day or so, or should you just, when you get home at night, put it on during the day, when you get home at night, throw it out, and then start the next day with a fresh mask?
Yeah, I think it's a balance. The masks, in a perfect situation, we would just keep disposing of them, but that has its downside too, both in terms of financial costs, but also environmental costs.
Right.
I think we should be mindful of that. The key things that I think about with my when I'm wearing a mask and deciding when to discard it. First, if it gets soiled, by all means, discard it right away.
Right.
If you notice that it starts to show signs of wearing down, like fraying, that could be a sign that maybe the filtration is going to be impacted. At that point, you'd want to discard it. And then if you find that the straps are loosening, it's not fitting tightly, also another reason to discard it. Absolutely.
So exactly how long have you been with UConn?
So I'm from Connecticut originally and went to medical school at UConn, and then graduated, did some residency in infectious disease specialty training in New York, and then came back to Connecticut in 2012, and I've been here at UConn since 2016 on the faculty in my current role.
Now, how big is the UConn Health system?
Well, the hospital itself, I think we're about 250 beds or so.
Wow.
We have a large foothold in the outpatient practice, so we have multiple outpatient sites throughout the region.
Okay.
And we also have, our sort of academic foothold with the medical, dental, and graduate schools. That's a big part of our campus, and then, a fairly large research component as well. So the campus itself is quite large and pretty extensive. Based out of Farmington, but also with sites at other parts throughout the state.
Okay, so you obviously you guys have multiple locations as well.
Yes, our infectious disease practice is primarily based here in the Farmington campus, but we do have some sites. We have a site in East Hartford, and we work with some of the other offsites to provide kind of consultation.
Now exactly with all the different campuses, obviously you guys are seeing patients, but you guys are probably being very cautious and very careful as far as who walks in the building.
Yeah, we are pretty strict. We have entry screening at all of our sites. We really don't want folks who are symptomatic to come into the health center. We have other ways to provide care, either through our urgent care centers. We also have drive-through testing that's available for folks who are mildly symptomatic and want to get tested. And then, of course, in the emergency room, we provide care to all those who need it. But we are being particularly cautious, with this recent surge in infections in the community with regard to patient entry and also visitor entry as well. Really trying to minimize the risk to our patients that are here, as well as our staff. Absolutely.
Now, what is the difference between or is there a difference between the Johnson & Johnson shot, the Pfizer shot? What is?
Yeah, these vaccines, there's many vaccines that are out there. The three here in the United States are currently what we call the mRNA vaccine, so the Pfizer and the Moderna vaccine.
Yeah.
And the Johnson & Johnson vaccine, which uses a slightly different type of technology to generate the protective immunity. So they work. So I'd say the Pfizer and the Moderna are very analogous. They're both 2 doses, and then in doing so, they generate a high level of immunity through that mechanism that kind of simulates the spike protein on the virus, whereas the Johnson & Johnson vaccine uses a slightly different technology to generate an immune response. It was initially rolled out as a single-dose vaccine, but I think subsequently the data has really shown that probably 2 doses is really what's needed to provide a robust response. So all those folks who got initial Johnson & Johnson vaccine are recommended to get a booster dose either with a Johnson & Johnson or now the preferred booster is one of the mRNA vaccines, the Pfizer and Moderna vaccines.
Dr. Banach, would you mind sticking around for another segment?
Sure.
All right, we'll be right back.
Contact tracing is one of the best voluntary ways to stop the spread of COVID-19, and information provided will be kept private. But imposters might pretend to be contact tracers to get access to your personal information or money. Real contact tracers will never ask for your social security number or financial information. You'll receive text or emails from contact tracers only if you have opted in. If you don't recognize the tracer's phone number, contact your local health department. To learn more about contact tracing, please visit portal.ct.gov/coronavirus/contact.
Hey world, I have a quick message. It's about safe driving. Alright, let's go. Anytime you're driving, have the seatbelt buckled tight. Both hands on the wheel and your phone out of sight. When not in your hand trying to text somebody back. Because if you do, your car might get smacked. The moral of the story, just put your phone down. The people on the road will stay safe and sound. Put your phone down, put your phone down. People on the road will stay safe and sound. Yeah.
Welcome back to this week's edition of the Pete Mezzetti Show. I'm Pete Mezzetti, sitting here with Dr. David Banach from UConn Health. Dr. Banach, welcome back.
Thanks.
Thanks. So, Dr. Banach, we were talking a little bit about in the first segment the virus, and I was wondering maybe if we can open up the segment talking about the other aspects of the COVID-19. I know we talked about the Omicron variants a little bit in the first segment. Maybe we can pick up and get a little bit more in detail about the different variances.
Sure. So, I mean, I think tracing from the beginning of the pandemic, the initial variant that we saw was what we term the wild type variant. So, the variant that was first identified, in Wuhan, China, and then spread throughout the globe. That's sort of the initial variant that we saw, and it, we learned a lot about coronavirus in general, particularly the SARS-CoV-2, which is the novel coronavirus, and we learned a lot about the illness that it can cause, how it spread. And then, I think tracing along the pathway, we saw subsequent variants. You may recall there was what was termed an alpha variant. So that was a slight change from the initial wild type variant that was seen initially in England and subsequently spread. And then later we saw, additional variants, particularly the Delta variant was another one that sort of appeared last spring and summer. What this variant showed, and the previous variants, seemed to be more infectious than the initial wild type variant, so they spread a little bit more easily. Fortunately, the vaccines provided a high level of protection against those alpha and beta and delta variants. Now we're testing it with the Omicron variant, which seems to be more infectious than these other variants, seems to spread much more quickly than the Delta variant, which was already highly transmissible. So, I think that's what's been notable about these new variants when they're identified, I think it really showed that it's really critical from a public health perspective that we monitor for new variants and get a good understanding as to what's circulating in the community and how we can react appropriately to try to prevent their spread and help keep people safe.
Now, if somebody feels like they have, how can someone tell if they're getting sick or if it's just a head cold as compared to if they think they have the virus?
Yeah, it's becoming difficult, particularly with vaccinated folks. Vaccinated folks, as I mentioned in the earlier segment, tend to have milder infection.
Right.
It can be difficult to distinguish between COVID-19 causing some nasal congestion, sore throat versus other viruses. And that's where testing can actually be really important in trying to distinguish between those different explanations. I think, unfortunately, because the community level transmission at this moment is very high.
Yes.
I think the default would be on the presumption that if you have new symptoms that are, sinus symptoms, cold symptoms, it's most likely going to be from COVID-19. Not always,
right.
But I think until you can test and feel confident that it's not, I think at the moment, presumption that it is COVID-19 would be the prudent approach. And that's in contrast to, like, if you'll recall last summer, rates of COVID were very low. So if you presented with nasal symptoms, probably more likely to be seasonal allergies versus COVID. So I think, that's what it's important to be mindful of what's happening in the community in terms of these viruses and trying to get an understanding as to the symptoms that one might be experiencing, because there is so much overlap between them. There's a few characteristics that seem to be a little unique about COVID. So the loss of taste and smell, for instance, not something that we commonly see with other cold viruses. That seemed to be a unique characteristic. And then, things like fever and cough tend to be a little bit more common with COVID compared to other kinds of infections, although, the flu can certainly mimic it quite well.
Right. Right. Now, obviously, washing your hands is probably another important one to try to prevent the spread of the virus as well.
Yeah, hand washing, important for all viruses, preventing the spread of viruses. It definitely, is an effective way and kind of the cornerstone of a lot of the infection prevention strategies that we have. Hand washing is always important, particularly if you're going to be doing some activity that's going to involve, face touching and eating and things like that. I think that's where hand washing can be most important.
I haven't figured out how to drink a cup of coffee with a mask on yet, so I guess that still has to be worked on.
There's probably some mask that's in design that allows for coffee sipping, but I think do your best to drink your coffee in a situation where you're probably not going to want to be wearing a mask.
Absolutely, because you don't want to wear the coffee over the mask, because then you'll have that big coffee smile on your mask, and that probably wouldn't look too good.
Yeah, it'll defeat the purpose of the mask.
Absolutely, absolutely. So what else we want to tell everybody about the variants and about the COVID?
Yeah, I mean, I think there's a few things that people should be aware of. So what we're seeing with Omicron is that the vaccines still hold up very well. So there's still an opportunity to get vaccinated. The protection that you get from the vaccine, it doesn't start instantly, but it starts to build even days after you get your vaccine. So it's not too late if you haven't been vaccinated. You're still thinking about it. We're at the point now where we've given out millions of vaccines,
right.
And the safety profile looks quite good. So if you haven't been vaccinated, go ahead and get that vaccine. And if you're due for a booster, also the boosters really seem to be very impactful in preventing infection with Omicron. So I think all the more reason to go out and get that booster. And then on top of the vaccines, those extra layers of protections, things like masking, trying to avoid enclosed spaces where lots of people are gathering, because we know that that's the type of environment where the virus spread. It all kind of builds on each other to try to maximize one's protection against COVID.
Now, obviously, if you feel sick or don't feel well, obviously go get yourself tested, and don't assume it's automatically the COVID. It could be a head cold. It could be a sinus infection.
Yeah, I think in addition to going to get tested, trying to isolate yourself. Not coming to work when you're sick. Trying to do what you can to avoid spreading virus to other people, in your household or in your community, and whether that involves, wearing a mask.
Right.
That's another way to kind of prevent spread if you do have symptoms. So all these measures can kind of can add on one another in order to try to reduce, the risk of spread as much as you can.
No, absolutely. We got a little bit more time left. So what else do we want to educate our viewers about?
Yeah, I mean, I think also be mindful of what's happening in the community. These what's become quite clear is that these COVID surges come, in waves.
Right.
So right now we're in the middle of a wave. Hopefully this wave will pass, and we'll be in a better position. But kind of be mindful, be attentive to what you're hearing as far as the risk in the community, and adjust your activities accordingly. This is probably having like large gatherings with people who you don't live with, or people are going to be eating and not wearing masks. I would really caution against that at this moment, and not to say hopefully in a couple of months things will look different. So just be mindful of what's happening around us, both kind of locally here in Connecticut, but also more broadly.
Absolutely. Now tell us how easy is it when you go and get tested?
So I think one of the challenges, and this is a big challenge right now, is access to testing. I think we at UConn Health we do offer testing, but the capacity is not unlimited. And all the hospitals, retail pharmacies that offer testing, are all really struggling to try to maximize. And we're doing all we can to get more testing availability, more capacity to do testing, here at UConn, just trying to build that as much as we can. But there's a lot of people out there that need to get tested. So, and that's where home testing can become beneficial. I know the state's been really out front in trying to get people access to home tests. So if you can get access to a home test, even if you're not symptomatic at the moment, having that available if you do become symptomatic, and then can readily test yourself, I think is important. So, and I think the testing capacity will continue to increase. Like I said, here at UConn, we're working to do that. Every day we're trying to figure out new ways to expand our testing, and all the hospitals and healthcare systems throughout the state are doing the same thing. So I think it will improve, but right now it's just not where we want it, or quite frankly where we need it to be. But I think we will get there.
Absolutely. And I was going to say, with the home testing, they're probably the accuracy percentage is actually pretty good, right?
Yeah, I think in terms of accuracy, really most helpful when symptomatic. So if you're having symptoms, that's the right time to get a home test. I think in terms of how they perform for people who don't have symptoms, I think they may not be as sensitive at detecting virus, probably because the virus levels are lower at that point. But once you get to the point where you're symptomatic, going ahead and getting that rapid test can be important. And as I mentioned earlier in the earlier segment, if you want to really maximize the sensitivity, if you get an initial negative, then following it up with another test, usually 12 hours later or so, can help make the test a little even more sensitive.
Now, as far as if you get a positive test, how long can the virus stay in your body for?
So, good question. We're learning. The standard had been for most people who have normal immune systems, aren't like very immunocompromised. 10 days of isolation is what was recommended.
Okay.
That's generally how long the virus can shed. In very immunocompromised people, it may be a bit longer. But I think we're learning a little bit more that a lot of the shedding occurs in the earlier portion of that 10-day period, which is why you're hearing recommendations. Maybe the isolation period can be shortened a bit, and I think we're kind of moving in that direction. But I think that the general stance is that 10 days is kind of the standard. But in some situations, it may be shorter. And there's also a lot of interest in using sort of follow-up testing to determine whether or not the period of isolation can be a bit shorter. And I think that's something that, as testing becomes more available, is going to become part of the isolation procedures.
Dr. David Banach from UConn Health, thanks for some time, and we'll see you again soon.
Sounds good. Thank you for having me on.
Thank you. On behalf of Dr. David Banach, I'm Pete Mezzetti. Thanks, good night, and we'll see you next time.